Thank you for entrusting your family member's care with Charleston Veterinary Referral Center. This video is to be a resource for you to refer to once you bring your pet home after a TPLO surgery. You will also receive written discharge instructions, and we're happy to answer any additional questions that you may have. Once your pet returns home, it may take several days for them to return to their normal routine, including eating and drinking. It may also take up to 5 days for your pet to have a bowel movement following anesthesia. We may have specific dietary recommendations for your pet, which will be included in their written discharge instructions. Over the next 8 to 12 weeks, it is important to keep your pet exercise restricted. During that time, they should be confined to a clean, small space with good footing, such as a kennel or crate. Too much activity in the recovery period could result in delayed healing and postoperative complications. For the first 2 weeks, the only activity should be slow, controlled leash walks with the use of a sling for bathroom purposes. Starting in week 3, you can begin to add in 5-minute walks twice daily to help build back muscle mass. You may increase the time of your walks by 5 minutes each week as long as it does not exceed a total of 30 minutes of walking per day. We ask that you evaluate the incision twice daily for any signs of increased redness, swelling, or any discharge. Some redness, swelling, and bruising can be normal, but should improve over the next few days while the incision is healing. If you note any redness, swelling, or any discharge, we ask that you contact us as soon as possible. We also recommend icing the incision for 10 to 15 minutes several times a day for the first 3 days after surgery. If your pet struggles or does not want to participate in this therapy, you do not have to continue. Additionally, your pet will be discharged with a hard plastic e-collar, which should be worn at all times until the incision is fully healed. Your pet will need to be rechecked 10 to 14 days following surgery to ensure their incision has healed. At this appointment, all sutures or staples will be removed. Your pet will also need to be rechecked 8 weeks from surgery for radiographs to ensure that their leg has fully healed. If weight bearing is not progressing, or if your pet was using a limb and then suddenly stops, we would like to know as soon as possible. Additionally, if your pet will not eat for more than a day, vomits 3 times or more, or has diarrhea for 2 days or more, we would like to know as soon as possible. Of course, if there's any time you're concerned, please give us a call. We're happy to answer any additional questions you may have. I'm Tiffany. I'm one of the technicians at Charleston Vet Referral Center. This is our model for today, Zed. He's a little bit nervous, but he's a good boy. We're going to demonstrate for you guys the appropriate way to ice an incision. So what we've got here is our handy dandy ice pack. You can use a flexible ice pack, or if you have frozen vegetables, that would work as well. And then we have just a small hand towel here. We're going to wrap the ice pack in the hand towel. And then for the purpose of a TPLO, your incision will be kind of in this region. So what we'll do is we'll just go ahead and wrap the knee with the ice pack so that it is over the incision, but also around the whole knee joint area. You'll just hold it there for 10 or 15 minutes, or if he got to a point where he wasn't tolerating it, we would go ahead and end the therapy at that point. Zed and I will now demonstrate how to appropriately do passive range of motion exercises, or PROM. Essentially, the purpose of this exercise is to help maintain joint mobility while recovering from TPLO surgery. What you'll do is, with their surgery leg up and your pet laying down on their side, go ahead and hold onto their leg kind of at the lower portion near their foot, and you'll gently flex the knee as far as it'll go and then a little further, and then extend the knee as far as it'll go a little and then a little further. You want to do this for about 30 repetitions, or if he starts to get antsy, we'll go ahead and give him a break and try again. We'll now demonstrate how to appropriately use a sling and support your dog while they're recovering from their TPLO. You can use a sling, which will be provided, or you can also use a towel or a sheet, whatever is most convenient, easier for you guys to use. What you'll do is, with your dog on a leash, go ahead and put it under their abdomen, near the back towards their pelvis, so that while they're walking around, you can support their hind end. You can see Zed will go ahead and take a couple of steps. I'll have a little bit of pressure on this sling, but not so much. I'll let him walk around if he feels comfortable. We're more so there to help give additional support, especially if they decide they're not comfortable to use their surgery limb yet.